Hello, this is Dr. Anju Singh recording exercise 22, Autonomic Nervous System, its structure and function, from Allen and Harper's 6th edition Laboratory Manual for Anatomy and Physiology. So the autonomic nervous system, it is a division of the peripheral nervous system, and this operates without conscious control. All right, so we did all the skeletal muscles, they are under conscious control. Everything in our body that is not under our conscious control, like vasodilatation, heart rate, endocrine gland secretions, a lot of other gland secretions, everything in our body that is not under our conscious control is regulated by the autonomic nervous system. All right. The autonomic nervous system has, again, like any other aspect of the nervous system, has sensory receptors and motor neurons. The sensory receptors are from your visceral organs and from the blood vessels, and they take the information to the central nervous system. And the autonomic motor neurons, they carry the nerve impulses from the central nervous system to smooth muscles, to cardiac muscles, to all the different glands in our bodies. All right, and these motor neurons, they are of two orders. One is the preganglionic motor neuron. These are the first motor neurons that synapse with the second motor neurons, which are the postganglionic motor neurons in the autonomic nervous system. And ganglion is, the part where the synapse usually takes place. Not always, usually. And we'll talk about that in a minute. The autonomic nervous system is divided into two different motor divisions. One is the sympathetic division, which is responsible for the fight or flight response. Activation of the sympathetic nervous system occurs during exercise, excitement, embarrassment, emergencies, and this results in all the series of physiological responses. For example, there'll be vasodilatation of peripheral blood vessels, but vasoconstriction of visceral blood vessels. And I think we've talked about this when we did the endocrine system. Think about, you just had a nice heavy breakfast, but soon after having the heavy breakfast, say a tiger walks into the room. Your first response is going to be want to run away from the tiger. So you don't want your blood going to your stomach trying to digest that heavy breakfast. That can wait for a little bit. You need to run away. So your blood is going to go more towards your skeletal muscles in anticipation that their oxygen demand is going to increase and you want to run. Your heart rate's going to go up, your breathing is going to go up. So all of that is through your sympathetic division. Parasympathetic does the opposite. And as you can see, I've sort of highlighted the R here in red, and that is for everything opposite of the sympathetic. So this is when you're relaxing, you're reading, it restores everything, it repairs everything. It's getting you ready for the next sympathetic innervation, if you will. All right, so the two are opposing. The activation of the parasympathetic has all the effects that are opposite to the activation of the sympathetic division. All right, so now we're going to talk about the anatomy of the sympathetic division. To start off, I borrowed figure 18.3 from here because I want to quickly recap what we did about the spinal cord in that chapter. Remember the spinal cord, we did the cross section of the spinal cord. We have the posterior horn, the anterior horn, the lateral horns, gray matter, white matter, etc. So all I want you to remember right now is remember the posterior root was a sensory root and the anterior root was the motor root. Okay? Now, in the sympathetic division, the cell bodies of the preganglionic neurons are located in the gray matter of the lateral horn. So the lateral horn was right here, so, on these two sides. So this was the lateral horn. This is where your cell bodies for the preganglionic neurons of the sympathetic division lie. And they lie only between T1 and L1. T1 and L2, sorry. And therefore, they're known as the thoracolumbar division. The axons from these first motor neurons of this division, known as the preganglionic neurons, will exit the spinal cord in the anterior or the ventral root. Remember, the anterior root is the ventral root. These are motor neurons. And just for simplicity's sake, I'm going to draw a line. They're not that easily and directly coming out like that, but just for diagram and model sake, I'm going to draw a preganglionic fiber coming out through the motor root or the anterior root, and then it goes into the spinal nerve and through the rami communicans. Whoops, I can't draw very well. I'm going to try this again. All right. So they come out from the lateral gray matter, lateral horn of the gray matter, through the anterior or the motor root, into the spinal nerve, which remember was a mixed nerve, and then it goes through the rami communicans to the synaptic ganglion. All right. Now this part is known as these fibers form the white rami communicans of the rami communicans. So rami communicans has white rami and gray rami, and these preganglionic axons of the sympathetic division form the white rami communicans. And some of these fibers will synapse in the sympathetic ganglion and some will not synapse. The ones that pass through the sympathetic ganglion without synapsing, they just turn around and go right back into the spinal nerve. And just for simplicity's sake, to keep the lines from blending into each other, I'm using the other rami communicans. It could just go up on the same rami communicans that it came down in. So the ones that pass without synapsing in the sympathetic ganglion emerge to form the splanchnic nerves. All right, splanchnic means viscera, so they will innervate the viscera, the abdominopelvic region. The nerve cell bodies of the second motor neuron, the postsynaptic ganglion neurons, which are located in the sympathetic ganglion, these will synapse, and the postsynaptic neuron cell bodies, some of these axons of the postganglionic neurons will return to the spinal nerve at the same level via the gray rami communicans. So again, for this model's sake and for simplicity's sake, I'm going to draw on the other side of the spinal cord. Again, coming out of the anterior root, going down the rami communicans, and this one, let's say, synapses. All right, and then the postsynaptic fiber comes back out, goes back this way, and these will form the gray rami communicans. So this one here will emerge as the splanchnic nerves. All right. And the postsynaptic axons are usually much longer because they have to travel greater distances to innervate the effectors. Now the sympathetic division itself has two groups, and we'll talk about that when we get to that figure. So I think we're done with this figure. I use this figure because I figured it'll be easier to understand that with this diagram. And we'll see a different view of the same thing. So this is again from figure 18.3. It's a lateral view showing that, again, we're not able to see the anterior root here because what we're seeing is this, the spinal nerve coming out. But presuming I'm drawing over the anterior root, we have your white rami communicans coming in, and some fibers without relaying will turn around and go back into the spinal nerve. And they could go into the posterior root or to the anterior root. That depends which organ they are going to be supplying. So this will be your splanchnic nerve that comes out without synapsing in the sympathetic ganglion. Whereas some of the fibers that come out from the anterior root will actually synapse in the sympathetic ganglion, and the postsynaptic fibers may go back. And then depending on which organ they're going to supply, this will be through the gray rami communicans. Now the sympathetic division has two groups of ganglion. And the sympathetic trunk, this is this chain here, this chain here, this is the sympathetic trunk. Okay, and there's one on the right side and there's one on the left side. They are paired. And then we have the prevertebral or collateral ganglion. This one here, the prevertebral ganglion. Now in the sympathetic trunk ganglion, the postganglionic neurons from these ganglion, they innervate organs superior to the diaphragm. So it'll be your esophagus, your trachea, the aorta, etc. All the involuntary innervation of the blood vessels and structures superior to the diaphragm will receive the postganglionic neurons from the sympathetic ganglia. The prevertebral ganglia, these are not paired, so these are single, unlike the sympathetic trunks, which we have one on the right side, one on the left side. The prevertebral ganglia are not paired, they are single. We have the celiac ganglion, the superior mesenteric, and the inferior mesenteric. These three single ganglia lie anterior to the abdominal aorta, as you can see in this figure. And their postganglionic neurons innervate organs inferior to the diaphragm. The preganglionic axons traveling in the splanchnic nerve. Remember in the previous figures we saw some of the ganglions do not synapse, some of the motor nerve fibers do not synapse in the ganglion, but they come out as splanchnic nerves. So these preganglionic axons traveling in the splanchnic nerves, they synapse with the postsynaptic neuron cell bodies in the prevertebral ganglion or in the adrenal medulla. Again, remember, adrenal medulla plays a very key role in your fight and flight response. So this is how that sort of ties in with your sympathetic innervation. So again, just making sure we've got all this covered. Number one was your right sympathetic trunk ganglion. Number two is the splanchnic nerves. Splanchnic nerves are the ones that are still preganglionic fibers. They did not synapse in the ganglion, the sympathetic ganglion, and these postsynaptic fibers innervate structures superior to the diaphragm. And then number three is the left sympathetic trunk ganglion. Number four is your prevertebral ganglia. These are not paired, and you have three of them: the celiac, superior mesenteric, and inferior mesenteric, and they innervate the adrenal medulla. So now we come on to the parasympathetic division. The cell bodies of the preganglionic motor neurons in this division are located in nuclei of four cranial nerves in the brainstem, and in the lateral horns of the spinal cord in segment S2 to S4. And therefore, this division is known as the craniosacral division. The axons of the cranial preganglionic neurons, they exit the brain from the 3rd, 7th, 9th, and 10th spinal nerves. So that is the oculomotor, the facial, the accessory, and the vagus nerve, your wandering nerve. All right? And they synapse with the postganglionic neurons in the terminal ganglion. The terminal ganglion is, as the name suggests, it's terminal. It's usually in the effector organ, and therefore the postganglionic fibers in these are very short because the ganglion is usually very close to or in the effector organ. So the major terminal ganglion in the head region are the ciliary ganglion, the pterygopalatine ganglion, the submandibular ganglion, and the otic ganglion. So in this figure, number one is the otic ganglion. Number two is the ciliary ganglion. Number three is the pterygopalatine ganglion. And number four is the submandibular ganglion. All right. So as you can imagine, let's just say, for example, if we're talking about, say, the pupillary reflex in response to light stimulation. So when you go to the doctor's office and they shine a flashlight in your eye to look for pupillary reflex. So your sensory neurons are within the retina. Your sensory fibers go up through your optic nerve. But your motor fibers, as they're coming down through your oculomotor nerve, your preganglionic fibers come out through the oculomotor nerve. They will synapse in the ciliary ganglion, that's number two. The postsynaptic fibers will go to the pupillary muscles and will make the pupil contract. All right, so that's one big difference between your somatic reflexes and your autonomic reflexes is you have two motor neurons, preganglionic and postganglionic. You have all the other aspects of a reflex arc, but you have this one additional aspect. You have two motor neurons. Somatic reflex only has one motor neuron. Autonomic reflexes have two motor neurons. Now, somatic reflex, remember, you can have a sensory neuron directly synapsing with the motor neuron and have no interneuron. A simple somatic reflex could be just two neurons, sensory neuron, motor neuron, period. But in a sympathetic or in an autonomic reflex, whether it's sympathetic or parasympathetic, you have two motor neurons, preganglionic and postganglionic. You can still have interneurons, you can still have communication with the other side of the spinal cord, with the spinal levels above and below, with inputs from the upper centers, from the cerebral centers. You can have all of that, but you always have two motor neurons, preganglionic and postganglionic. All right, so as I said in the previous diagram, autonomic reflexes have pretty much the same components, if you will, or similar components as somatic reflexes. But they are all polysynaptic because they all have a ganglion, and they will have two motor fibers, a preganglionic motor fiber and a postganglionic motor fiber. So that's how autonomic reflexes differ from somatic reflexes. Remember, autonomic reflexes are controlling all the unconscious responses in your body, like blood pressure, respiration, digestion, salivation, a whole number, everything that you consciously cannot control. You know, movement of your GI tract, secretion of GI digestive juices, your epinephrine, norepinephrine secretions, and stuff like that. So all of that is controlled by autonomic reflexes, and there's a lot of control from the brain, the hypothalamus, and the integrating centers. So all the autonomic reflexes are polysynaptic. Somatic reflexes can be just monosynaptic, synapse between sensory and motor neuron, and that's it. You can have some very basic somatic reflexes involving only two neurons, sensory neuron and motor neuron, and that's it. That does not happen in autonomic reflexes. Autonomic reflexes are always polysynaptic. So they will have a sensory receptor. They do have a sensory nerve. They will have an interneuron invariably, and this interneuron can connect with the opposite side, with the neurons in the higher and lower levels of the spinal cord. It will communicate with the brain, with the thalamus, hypothalamus, and all the other parts of the brain. And then the motor neuron, there'll be a preganglionic motor neuron and a postganglionic motor neuron, which will finally relay on the effector organ. All right, so that's one huge difference between autonomic reflex and somatic reflex. So if we were to presume this is a response, say, to a light stimulus. So in this case, in this figure, your receptors, your stimulus is the light. The receptors will be photoreceptors in the retina, which will be carried up through the sensory nerve, which is the optic nerve, which is a pure sensory nerve. They will be relayed up in the occipital cortex of the brain. They'll be integrated through numerous pathways and other interneurons in the brain. And the motor fibers will finally come down through the third nerve, the oculomotor nerve, and will synapse in the ciliary ganglion. And the postsynaptic motor neurons will then innervate the muscles in the iris and will cause pupillary constriction. Now, the other important thing here is, even though you may, and you can try this at home, try it in a dimly lit room, and have the person you are doing this with, or you can do it just with yourself in front of the mirror. You know, if you stand in the bathroom and turn the lights off in the bathroom and have a small flashlight or even your phone light, and shine the light from your phone only on one eye from the side, not even directly in the eye, just from the side. You will notice both your pupil will contract, even though only one pupil has been stimulated by light, because this will be a bilateral response. All right, and that is again very common in the autonomic nervous system. Just making sure all these, you identify all the parts in this figure. Number 1 is the interneuron. Number 2 is the axon of the sensory neuron or the afferent neuron. Number 3 is the sensory receptor. Number 4 is the axon of the preganglionic motor neuron. Number 5 is the autonomic ganglion, which could be sympathetic or a parasympathetic ganglion, depending on which reflex arc we are looking at. Number 6 will be the axon of the postganglionic motor neuron, and number 7 is your effector, your visceral effector. So it could be a smooth muscle in the gastrointestinal tract, it could be the smooth muscle on the blood vessel, it could even be a gland, it could be any visceral effector. So I'm just going to go through this activity 3. I think I covered most of this, just to answer some of the questions on page 348. So the first thing they're asking, and this is again about the pupillary reflex. So is this reflex a somatic or an autonomic reflex? The way you would answer that question based on any reflex, whether it's a pupillary reflex or knee-jerk reflex or whatever reflex, can you consciously control it? If you cannot consciously control it, it is most likely an autonomic reflex, okay? Identify the nerve that is carrying the sensory information to the eye. That's the optic nerve. Identify the cranial nerve carrying the preganglionic parasympathetic axons to the ciliary ganglion. That'll be your third or your oculomotor nerve. Is this a monosynaptic or polysynaptic reflex? It is polysynaptic. And is the pupillary light reflex ipsilateral, contralateral, or both? It is both. It is a bilateral reflex. So here, the other thing about the autonomic nervous system is the role of the cerebral cortex and the limbic system that is also responsible for your emotion, also called the emotional brain, and the input from the thalamus. So these impulses, especially because they're not under our conscious control, are used to detect lies in patients. And you must have heard of the lie detector test or the polygraph. Now, this is based on the presumption that most people are usually truthful, and when you're telling the truth, you are, your body is functioning normal. There's no, sympathetic response, if you will. But if you are telling a lie, then you have a sympathetic response, which means you're going to be sweating, your heart rate goes up, your blood pressure is going to go up, your respiration is going to change. And that response, because it is not under conscious control, is recorded to know if a person is lying. Now, again, this is not foolproof because some people are able to pass the lie detector test, like pathological liars, sociopaths, psychopaths. They have no emotional response to telling lies. So they would fly through this test. But for the majority of normal population, if you will, this is a good way to know if a person is telling a lie or not. And you've probably experienced it in your life, when you are caught, when you're cornered and you've been caught for something you did as a child and your mother finally found out, you can probably recall, like your blood drains from your face and your heart rate goes up and stuff. So this image here is basically of a polygraph test reaction. On the left side is when the person is answering the questions truthfully. You've got a pretty regular chest movement during respiration. You've got a pretty regular abdominal movement during respiration. And the skin conductance is measuring your sweating. And the heart rate is, again, pretty regular. Blood pressure is pretty regular. And towards the right is when the person is telling a lie. That's, you can see the chest movement and abdominal movement and respiration have become shallow. The person is sweating, so the skin conductance has gone up significantly. The heart rate and blood pressure have gone up. And that's usually that's what the polygraph test is kind of sort of losing its credibility because hardcore criminals tend to be more on the psychopath, sociopath, and are able to fly through these polygraph tests. But this is just another example of how the autonomic nervous system can be useful in detecting certain criminals. And to end this chapter, although the autonomic nervous system controls everything that is not under our conscious control, we can, to some extent, consciously influence our autonomic nervous system. So it's kind of sort of the opposite of your polygraph test. It is if you do exercise breathing, deep breathing and relaxation, for example, meditation, you can influence your autonomic nervous system. So you can decrease your sympathetic stimulation and you can increase your parasympathetic stimulation. So you can increase your repair and restoration of the body. And that's the role of deep breathing and meditation. In the end of this exercise here in the book, they talk to you about, give somebody a bunch of math problems and record their pulse rate and blood pressure, and then ask this person to, take rest, take deep, slow breaths for about 10-15 minutes and see what happens to their pulse rate and blood pressure. And I'm sure in your daily lives, you all have experienced this too. Is, you have exam anxiety. When you're studying for an exam, you're thinking about an exam, you're trying to come up with questions and reviewing for an exam, you have a higher anxiety. Your breathing is shallow and maybe rapid. Your heart rate's higher, your blood pressure is higher, your hands are clammy and sweaty and cold. That's because you've got a higher sympathetic tone. But after the exam, you sleep in, you're sleeping in, you're doing nice deep breathing, you're relaxing, and that's your parasympathetic stimulation coming in. And with that, we end this chapter. I would again encourage you to do the review at the end of this exercise, just to make sure you understand how this works. And as I said, if you understand some key components as to what the sympathetic and parasympathetic innervation does, you should be able to answer most of the questions, okay? A lot of it is, once you know those key components, the rest is just more or less common sense. So if I give you a situation, you know, you've been caught in a lie. What do you expect what's going to happen to your heart rate or blood pressure? Or soon after the exam, the day after the exam, do you think you're going to have a high parasympathetic or higher sympathetic tone? You know, some basic questions like that. So once you're able to do these exercises at the end of the chapter, you should be good. All right. Thank you.